I'm Dr. Raymond Douglas, and today I'm joined here with Dr. Stacy Pineles of the Joel Stein Eye Institute, and we're talking a little bit about strabismus and what are some non-surgical options for patients who have double vision but may or may not be surgical candidates. What can people do? Stacy, thank you so much. I know you're an expert in strabismus and double vision, known for quite a long time. So what are some aspects that a patient can consider for if they're thinking about surgery or if they're looking for non-surgical options when they have double vision? What type of patients fall into those categories?
Well, many patients can fall into either category. There are some patients who want to avoid surgery for whatever reason, whether they don't want to have anesthesia or they feel like they've already had lots of surgeries with their eyes related to thyroid disease and they don't want any additional surgery. Or if their double vision is not very bad and only happens when they're driving, for example. These types of patients sometimes wish to avoid surgery, and there are people who may want to consider a non-surgical option. Patients who really need surgery if they want to alleviate their double vision and are not candidates for the non-surgical therapy are those who have a large amount of eye deviation. So the doctor will measure your eye deviation and tell you whether or not non-surgical options will work for you. If the alignment of your eyes, the deviation is small, then you may be a candidate for a non-surgical option.
Okay. What are some of the non-surgical options that are available?
The main non-surgical option is prism glasses, which is a type of glasses. It looks like regular glasses, but instead or in addition to the refractive correction, there's also prism added to the lens, and a prism is something that bends the light or bends the image to achieve single vision in one or both eyes.
A lot of patients ask me about vision therapy and trying to improve their vision in other ways. Are some of those conditions treatable with vision therapy or not?
Vision therapy is not thought to be a good treatment for patients with strabismus due to thyroid eye disease. There's one condition called convergence insufficiency in adults that can be treated with vision therapy, but that's extremely rare in patients with Graves' disease, and so in general I would not recommend vision therapy.
Yeah, that's often been all my experience too. In patients with thyroid eye disease, the muscle is fibrotic, scarred, and expanded, and it just doesn't function well, and so often it needs either a surgical or non-surgical correction, such as you said with prisms. Do prisms often cure the problem, or do they just kind of like a crutch?
I don't want to say crutch because crutch has kind of like a negative connotation, but the prism is not a cure. The prism, if it works for a patient, is going to work when the glasses are on, but when they take the glasses off, they'll have double vision. So I call it like a temporary fix because when it's on, it's working, and when it's not, it's not.
Okay. And the other final question that everyone asks is, will the prisms make my eyes worse? Will they make them, will I get more double vision because I wear prisms as opposed to not wearing them?
The prisms are not going to change the alignment of your eyes. Sometimes patients notice that if their double vision was intermittent before they started wearing the prisms, that when they take the prisms off, it takes their eyes a little bit longer to adjust and they see double more. That doesn't mean that their condition is worse. It just means that their eyes are having more trouble rapidly adjusting to a lack of prisms because they had the prisms on for a while. So the prisms don't make it worse, but sometimes they can make intermittent double vision occur a little bit more frequently when a patient takes the glasses off, just because their brain got adjusted to the prisms.
Okay. And would you suggest for a patient with thyroid eye disease seeing an ophthalmologist who specializes in strabismus surgery, or at least has a good knowledge of it, and then weighing their options between surgery, non-surgery, and then potentially pursuing prisms, because prisms can be prescribed by non-ophthalmologists or optometrists too. But I was just wondering what you thought as far as how patients may seek advice.
Yeah, I think it's a good idea to seek advice from somebody who's an expert in strabismus surgery. And the reason for that is if you don't know about strabismus surgery, then you're tempted to prescribe prisms for every patient who has eye misalignment, even if the prisms may not be the optimal solution. So somebody who understands prescribing prisms but also understands strabismus surgery is a good place to start because they can lay out all of the options for the patient and discuss the pros and cons.
It's great to know your options. Thank you so much, Stacy.
Thank you.